My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Joy Mwesigwa and I am your host. For those who are new around here, this podcast is about health. We talk about health topics, diseases, illnesses. We want you to keep healthy. We want you not to avoid those illnesses. And we talk about it in a fun way. We also talk about other aspects like telemedicine, tech in medicine, health law, anything concerning health. We want to empower you and we want you to know that you're the first person who's responsible for your health. So for today, I have a guest and he has been here on the podcast with us before. His name is, okay, you will see him. And due to public demand, some of you wanted him to come back. And so he is back, and today we're going to be talking about an interesting topic, and that is monkeypox. I'm sure some of you have been seeing videos going around, or Ministry of Health stickers, or they call them, I think, chats. Yeah, chats about monkeypox. Mpox is here. What is Mpox? Now we're going to be talking about Mpox, and also he's not Ugandan. He's from another country, which is also facing the same issue. And so we are going to be talking about it. We want you to know what monkeypox is, how is it transmitted, how does it look like. We'll be putting some pictures to show you how it looks like. And so you're very welcome, our guest.
Thank you, Joy.
How are you?
I'm okay.
Nice to have you again.
I'm happy to be here for sure.
Yeah, so could you introduce yourself to our viewers for those who may not know you?
So hello everyone, my name is Lens Mosita Kullie. I'm a Liberian, a fourth year medical student and also a classmate of your host Joy. And like I always say, it's always a privilege to be a part of this place. We are here to talk about monkeypox and I'm happy to be here to give you up-to-date information up to 2025. And we've done a lot of assignments and we hope and pray that this information that will be provided will be used for the benefit of the population.
Yes. What's your nationality?
I'm Liberian.
He's Liberian. Okay, anyway, just to put that across. So let's dive into the conversation. What is monkeypox in simple terms for someone who may not, who's just hears the word monkeypox? What is it? Where does it come from? Yeah, a brief about it.
So monkeypox is a zoonotic disease. When we say zoonotic, we mean those diseases that are transferred from animals to humans. So it's very zoonotic, and it was first is infectious as well, and it was first derived in 1958. That's according to WHO, and it was first derived in or identified in monkeys, but then within a couple of years and the development that took place, we found out that it's also present in rodents. So the fact that it's also present in rodents, and you know that rodents like rats and other primates are things that are always within our environment. So it's highly necessary that for us who are living in conditions that are exposed to those rodents are at risk of getting monkeypox. Yeah.
Rodents, rats. So how is it transmitted? Is it only people who eat the rats, or even just having a rat in my house and it's like maybe accesses my food, or it's just being around? Like, how is it transmitted? Because
okay, for Africans, we eat a lot of animals. I think you know possum. Do you know possum?
No.
In our country, we call it opasho. Basically,
opasho.
Yeah, we call it opasho.
What is that?
So it's like a mouse-like, it's a species of rat you get, but it's very, very big. It's not your typical regular mouse size. So a lot of people eat those things. So you can
opasho.
Opasho.
So they like roast it, or
they roast it, they cook it in soup, they do everything with it. Like
wild or domestic?
It's a what? I don't want to say wild, but it's a rat in the bush, basically. So those animals are known to be the ones that are carriers of this monkeypox. So either you come in close contact with it from maybe the flesh, the body fluids from the animal to you, or also it can be spread from humans to another human. So you also need to be very cautious when you hear that someone has monkeypox. You should also be very, very cautious because it spreads through bodily fluids, it spreads through saliva, mucous glands, and everything. So ideally, you need to be within, other studies will tell you need to be within 6 feet or more from that particular person so that you are safe from getting monkeypox, because anything less than 6 feet puts you at a huge risk of developing monkeypox. Yeah.
Interesting. So how does it present? How can you know that that person might be having monkeypox?
So
or I might be having monkeypox.
So monkeypox is, like we said, is an infection. So you are going to have your typical infectious signs and symptoms like fever, headache, muscle pain. You're going to have some typical rashes that are going to be on your skin, and it's very, very evident. I've seen several cases of it. We also had an outbreak back in my country, Liberia. And you have these patients presenting with pain. They are in severe pain. They have headaches, and you have the rash all over their skin. And then there are several different stages of these rashes. So it starts from, okay, medical terms, you have macules, papules, pustules before it goes to crusts. So when you look at those symptoms, that's how coming in contact with that particular person can actually put you at risk for developing monkeypox, basically.
So when this person gets the monkeypox, is it curable or they are supposed to write their will?
Okay, yeah. So monkeypox is curable, and a lot of studies, even according to WHO and CDC, it's self-limiting. So the incubation period,
Really?
yeah, the incubation period for monkeypox is between 6 to 21 days, and that's according to WHO. So in between those periods, the definition of incubation period is basically the time you got in contact with this virus to the time you start exhibiting signs and symptoms of the disease. So basically between 6 to 14 days, 6 to 21 days, given within that range, that's when you can start having signs and symptoms of monkeypox, including the headache, the fever, and the chills, and everything that we talked about earlier. Mm-hmm.
So when you get it, is it like self-limiting? You mean like it can heal on its own?
Yeah, it's possible if you have a very good immunity. But basically, one of the things that we would like to do for those patients will be able to treat symptoms. It's good. You need to treat the symptoms because it's very uncomfortable. It's painful. So you need to provide a lot of ORS for patients who are over vomiting in case it happens, and then also pain meds for patients who are suffering from severe pain. Depending on the scale of pain, you will have to tap the analgesic medications in that light. Yeah.
So if in case I have a relative who has it, maybe my close person that I live with, how do I protect myself? Because I may not be able to do the 6 feet because now they are getting dehydrated. They need me.
Yeah.
How best can I protect myself?
Okay, the very first thing, even in first aid, the very first thing you need to do is to make sure who's going to be delivering care, you are safe. So basically, those patients who come up with monkeypox, you first need to isolate them, even if it's within the house, because within our resource limited setting in Africa, we might not always have those quarantine centers for our patients. So the very first thing you need to do is to isolate these patients. If it's your cousin or your brother or someone within your house, make sure you isolate them. They are in one room and they cannot leave their room. And make sure you give them everything that they need, like their water, their food, just to make them feel seen and heard and as they go through this whole phase, because there are several different stages as monkeypox goes along. Yeah.
Okay. Any other interesting thing you tell us about monkeypox?
Like I said, monkeypox was a misnomer. That's what we need to know. It was a misnomer. And the very first monkeypox case was developed or identified in monkeys in 1958. But the very first human to get infected from monkeypox was actually in 1970. Can you imagine that? So it means
1970.
that... So
Where were they
1958 from DRC.
DRC.
DRC always has those, yeah.
Okay, that's interesting. So what are the take-homes from this?
One of the major things I would like us to talk about would be the statistics. So for the prevalence of monkeypox right now within Liberia, according to NPHIL, National Public Health Institute of Liberia, we have about a total suspected cases of 855. As those who actually had the disease, and the contact tracing for all the people that may have been suspected to have had the disease. And then from those 855 patients, we had about 753 samples that has been collected from those patients. You get. So those were the samples that were lab tested. And out of those 753, we had 164 confirmed cases in Liberia. So it simply means that, yes, the amount of exposed people, the number is high, but at least to some extent, the amount of people who actually have the disease right now is a bit low. Then for the active cases, we're talking about those patients who are already exhibiting signs and symptoms of the disease. We have about 71 people in the country. And then also when it comes to the recovery rate, we have 95 persons that have recovered. And fortunately for us, we have no death rates, which is very, very good. However, the capital city of Liberia is Montserrado County, and it also has the highest incidence of monkeypox, which is about 50. And this data I'm giving you is from NPHIL, and then it was published between June 1st to June 2nd. So until the second data comes, which is supposed to be on the weekend, we are going to have further updates on it. But that's very, very specific towards Liberia and how we can be able to understand the prevalence of this disease in our country. Yeah.
That's interesting. Thank you so much, Lens. To our viewers, I think from this episode, we need to make sure we don't... Okay, I don't know. Do you advise people to eat rats before I even say anything?
I wouldn't.
Because now we have seen monkeypox spreads through eating rats or being in an environment with them rodents. Any rodent. So probably find a way of trapping those rats in your house or getting rid of them. They are not safe. Actually, we are not, unless it's a pet that you're taking care of. Maybe a cat you're taking care of, or a dog you're taking care of, or the other pets that people have. But if it's not an animal you're taking care of and it's in your environment, you don't know where it's going, you don't know where it gets its food, probably from your food, but it gets out, it comes back in, it's bringing in things that you don't know about, germs, it could be having the monkeypox virus. So just make sure your environment is clean and safe. There are so many ways to trap these animals. I think they're like those traps that they sell in Uganda. Even those guys, when sell them, like when they're moving and then you just hear some guy with a microphone, rat traps, cockroaches, what? Please get rid of those animals because they may not be safe for your health. And be vigilant. Be vigilant when you see anyone with those signs and symptoms we have talked about, the fever, anything that's not normal. Please seek for help and make sure we protect each other because this is something we can eradicate in the whole entire world. Thank you so much for watching this episode. Hope you had fun. And thank you so much for tuning in. We have come to the end of the episode and we want to remind you that we air every Saturday at 8 p.m. on the My Doctor Africa platform and the Hi People TV. So be sure to watch these episodes and learn something new. This is the My Doctor podcast. My Doctor, your health, anytime, anywhere.
My Doctor, your health anytime, anywhere.